Good morning, everybody. Thank you so much for joining me today to talk about the work that we at the British Association of Social Workers have been doing on what is called a capabilities statement for social work with adults with learning disability. So on the screen now, you can see a photo of me on the left-hand side. Um, I am a qualified social worker, and after practicing in social work for a number of years, I then became a social work academic, and I was involved in training social workers. And now I work for the British Association of Social Workers. The British Association of Social Workers is a group of about 20,000 or so social workers across the UK, in Scotland, in Ireland, Northern Ireland, in Wales, and in England. And our job is to really speak up for social workers. And that also means speaking up for children and adults who use services and also their carers. So we try to speak up for their needs with the government. What I'm going to talk about today, the capability statement, was developed from some money given to us by the Department of Health and Social Care. And the Department of Health and Social Care is the part of the government which is responsible for adult social care and also health. And that includes the needs of adults with learning disabilities. So they gave us some money to develop this capabilities statement, and we work together with research in practice to develop this work. So there are actually two capability statements that we have been funded by the Department of Health and Social Care to develop. One, which you can see on your screen now, the left hand side one, it's for adults with learning disability, and the right hand side is for autistic adults. But today, this morning, I'll be talking mostly about the one on the left hand side, which is the capability statement for adults with learning disability. So the first thing that I want to start with is to explain what we mean by capability statements. When we talk about capability statements, we're trying to think about three main issues with social work practice. The first one, starting on the left-hand side of the screen, is, well, what skills do social workers need to be able to work well with adults with learning disabilities? In other words, what should social workers be able to do to make life better for adults with learning disability? The second part of what we mean by capability statement is, well, what should social workers know? What should they know about the needs of adults with learning disability? What should they know about services for adults with learning disability? What should they know about the needs of carers of adults with learning disability? And the third part of what we mean by capability statement is values of social workers. That is, what should social workers really believe in about what is good and what is proper and what is right for adults with learning disability. So what we set out to do at the British Association of Social Workers is to try and think about these three things: the skills that social workers need, the knowledge that they ought to have, and the values that should lie at the bottom of their practice with adults with learning disability. So I have now explained what we mean by capability statement. On the slide that you can see on screen now, I have shown what I will be talking about this morning. I'll be talking about four things. I'll be talking about A, what we ourselves, in the British Association of Social Workers, what we needed to do to understand the needs of adults with learning disability. And this was important because if you're going to really try and talk about what social workers ought to be able to do, what they need to know, and the values that they need to have, then you need to understand the situation of adults with learning disability. You also need to understand what affects them and how. And we also needed to understand what their current situation is. So that's one part of the work that we did to develop the capability statement. The second part, and that's perhaps the more important part of my conversation this morning, is what we did to involve adults with learning disability in the work that we did. And we involved adults with learning disability throughout this work because as social workers, we believe that it is the right thing to do. We believe that if you're going to talk about the needs of adults with learning disability, then you need to ask adults with learning disability and involve them. So I'll talk a bit about how we involve them. And then the third part, which is the bottom left-hand side corner, which has number 3 next to it. The third part is what we learned from adults with learning disability from involving them. And then the fourth part, again, a really important part of what I'll talk about this morning, is what adults with learning disability told us. They told us that the most important thing for them in terms of what social workers should be able to do with them is really relationships, putting relationship at the center of the practice with adults with learning disability. So those are the four things that I will talk about this morning. So I am starting now to talk about what we know about adults with learning disability. And I have got this information from research, from what people who work in universities and people who study the needs of adults with learning disability for a living, what they have told us about what people need. So I'm going to talk a bit about that. And I'll start off with figures. What do we know about the number of adults with learning disability in England? These figures are from 2016, and at the time, it is estimated, it is assumed that there are 930,400 adults with learning disability in England. Out of those, 252,000 of them are known to health services. And by that, I mean GP, general practitioners, I also mean hospitals, and I also mean NHS services. So 252,000 of those are known to NHS services. However, only 124,000 of those receive support from local authorities. And most of these people live with their families and their friends. The key point about this 124,000 people receiving support is that that's less than the number of people who actually want support from social services or social workers. So if we're going to think about what social workers need to be able to do and what they need to understand, then one question that arises from these figures is that, well, Social workers need to be able to connect people to services in the community. They also need to be able to assess the needs of people who need services. On this slide here that you can see in front of you, we're talking about the needs, the health needs of adults with learning disability, what we know about that. And it's shocking that the figures suggest that people with learning disability die younger than the rest of the population. So if you're a man with learning disability, die 13 to 20 years earlier than the rest of the population. And it's even more for women, 20 to 26 younger for women. That suggests, therefore, that there are premature deaths. People die before the expected life expectancy. And the reason for this is because of delays in care or treatment for adults with learning disability, the gaps in service provision for them. Health services don't really always respond appropriately to people's needs, or shockingly, sometimes health services neglect or abuse people, and that therefore can lead to their premature deaths. Apart from premature deaths, adults with learning disability are also more likely to experience mental illness. So the figures suggest that 28% of them experience mental illness. But if you include people who have behavior that services find challenging to manage, then the figure increases to 48%. So nearly half of adults with learning disability have some mental health need. So I have spoken, just touched briefly on the health needs of adults with learning disability, and I've spoken also about the number of people in the community who need support from social services. The slide here that you see in front of you tries to explain how services for learning disabled services are set up in the health and social care and also in the NHS. And we can think of four levels of services, starting from the bottom to the top. For the top services, top layer of services are for people whose needs increase and or are higher. So at the bottom is services for everyone in the community, which we call universal services. An example of those is, for instance, GP services that we are all we all are entitled to. Then as you move higher, you go to community-based support in social services, which is where most people who receive social services support would be familiar with, which is integrated services, which include social services and people also from the NHS, for instance, doctors, nurses, occupational therapists, and speech and language therapists. And then the third tier of support, as you go even higher, is those who are considered to need specialist support services in the community, and those sometimes who might have difficulties with their mental health, or services might struggle to manage their their behaviors within the community. And then we also include those who would need to be admitted to hospital or in specialist residential units. And you can see on the left hand side, there's an arrow going to the top, which has social workers written in it. What that is showing that social workers are involved in all these layers of support services for people
Oh, Godfred, I think we've lost you there. Let me see what I can do. Sorry, everybody.
Oh, can you hear me?
Oh, there we go.
Can you hear me?
I can. Can everybody else let us know in the chat? I think we lost you just at the end of the last slide, Godfred.
Okay, great. So I will begin talking about the next slide, and which is on your screen now, and it's entitled "What is Social Work?" And I was saying that it's important for me to explain what social work is because adults with learning disability usually have work with a number of professionals, and for some people it's not always clear who is doing what. And in this work that we did, one of the important things that we found out is when we asked adults with learning disability what they want from social workers, some of the questions are, well, who is a social worker? People talked about their support worker as if they were talking about their social worker. So it's important for me to explain what social work is. So social work is actually um, the technical term, the fancy term, the jargon term is that social work is a legally protected title. Well, what does that mean in everyday language? What that means is you cannot actually call yourself a social worker unless you have done the training and are registered with the Health and Care Professions Council. So not everyone can call themselves a social worker. And in fact, if you call yourself a social worker and you haven't done the training and you haven't registered, then that's it. That's not lawful. So that's the main thing. The second thing is that to be a social worker, you need to do a university degree. And the university degree is either 3 years for your first degree, this is the first time you're going to university and you want to be a social worker, you will do what's called a first degree, and that lasts 3 years. Sometimes people have already done a first degree and they still want to qualify as a social worker, and they will do what's called a master's degree, and that lasts for 2 years. So that's the second thing that you need before you can call yourself a social worker. The third thing that you need before you can be a social worker, or what is required of social workers, is they need to register their title with an organization called the Health and Care Professions Council, soon to change over to Social Work England. You need to register with them, you need to maintain your name on the register, and you need to do certain things before you are allowed to be on the register or your registration is maintained. So that's, you need to do a certain hours of training every year. So the three top layers are very, very important. So not everyone can call themselves a social worker unless they've done the training. And then most people, when they do their training in universities, they're trained to work with all people who need services, children and adults, people who have learning disability, or adults who may, for instance, who use dementia services, children who are looked after by the government or by local authorities. So social workers, most of them are trained to work with everyone. That also explains why the capability statement is so important, because what we were trying to do then is to say, look, if every social worker is trained to work with everyone, what about the particular needs of, say, adults with learning disability? What are the sort of things that you need to do to work with them? So that's why the capability statement was important, because social workers are trained to work with everyone. And the last point that I want to say about social workers, it is a job. Most of the people who do the job do it because they believe that they have a sense of what's right and proper. So the jargon that we use is that it's a value-based profession. We believe in human rights. We believe that it is right for everyone to have a certain standard of living. We believe that it is right that people are not discriminated against. We believe we believe that it is wrong for people to be removed from their families unless it's absolutely necessary. So these are the five main things that I want to pick out about social work. So the next slide that you can see here is my attempt to explain what social workers working with adults with learning disability do. And you can see that social workers do a number of things. The green, the green circle on the outside, we're starting from the outside, moving inwards towards the sort of yellow circle in the middle. And the green one starting from the outside, I'm trying to highlight that social workers do a number of things in with adults with learning disability. They do assessments. They also plan the care that people need. They advocate for them. They ensure that their care plans are reviewed or their care plans are thought through regularly to ensure that it meets their needs. And because social workers do so much within the community, it is sometimes very, it is sometimes not easy for us to tell the differences between their work and other professions. So the blue circle inside the green circle also shows that social workers are involved in assessing mental capacity of adults with learning disabilities. So they make assessments to determine whether people can make decisions for themselves. And before they do this, they try to support people to make as much of their decisions for themselves as possible. And if they're not, they put in place measures to protect that decision-making capacity. Social workers also work with people on their housing. They work with them on their benefits. They work with other professionals and explain the law to them because they're very good at understanding the law and how the law relates to what people need in the community. Social workers, as I said about 2 slides ago, also believe in human rights. So one of the main part of their job is ensuring that the human rights of adults with learning disability are protected in the community and are also enhanced. If we move up again, we can see mental health written there. Social workers work with adults with learning disability around their mental health. You know, if people need specialist mental health services, then social workers work with them. And then last but not least, this is getting more and more importance. Social workers also ensure that adults within the community, adults with learning disability in the community are safeguarded, they are protected from risk that they may be exposed to otherwise. So social workers, as you can see from this slide, do a number of very important work in the community with adults with learning disability, and it's not always in the community as I showed in the slide. Sometimes adults with learning disability live in residential placements, and social workers work with them as well. So I have explained what social work is, what social workers do with adults with learning disability. I have explained some of the research about the needs of adults with learning disability in the community. These are the sort of knowledge that we ourselves at the British Association of Social Workers needed to know before we could start thinking about what social workers need to know to work with people with learning disability. So I've explained the background to that work. Now I'm going to talk about the work that we did to develop the capability statements. I'm going to start talking about how we involved adults with learning disabilities in that work. Right? We involved adults with learning disabilities because we wanted to know their thoughts on the issue. We wanted to know what they wanted from social workers, and we also involved social workers in this important work. So to develop the capability statements, as well as involving adults with learning disability, we also had focus groups, and I'll explain what that means in a second. We also did a survey, which is asking a lot of people specific questions that everyone who wants to be involved in the survey answered. So we did that survey. And then the top left-hand corner, you can see literature review. That's the research part that I spoke about a moment ago. And then we also interviewed social workers on the telephone. So broadly speaking, these are the things that we did to develop the capability statement, but I am only going to talk specifically about the involvement of adults with learning disability. So there were 4 main ways that we involved adults with learning disability in the project. So there was what we called a stakeholder reference group. That really means a group of people who came together to give us advice and also give us suggestions about the sort of things that we needed to be looking at, right? And that group involved adults with learning disability. It involved social workers. It included managers of services, and it also included people who work in universities, and their job is really to study the needs of adults with learning disability. So that's what we call the stakeholder reference group. Adults with learning disability were involved in that. So they sat on top, if you like, overseeing the project, looking at the project, giving us advice, and trying to shape the project to be as best as possible. So that's one way adults with learning disabilities were involved. The other way that they were involved is we interviewed them, and also we had focus groups with them. And I'll talk about that in the next slide. The third way that adults with learning disability were involved is when we wrote the capability statement, we wrote a first copy of it. We then gave it back to adults with learning disability to read it and tell us whether we've got things as right as possible. So they were involved in reading the draft and giving us feedback. And then they also advise us how to do an accessible version of the capability statement. And then last but not least, when we actually launched the capability statement, when we had a big group of people come together to tell them what we have done, adults with learning disability were there and they spoke at that event. So they were involved in all aspects of the project. So here I'm talking about interviews and focus groups. And some of you listening now would be familiar with some of the groups who were involved. These are advocacy groups, learning disability advocacy groups. One of them was Staying Up Late, which is based in Brighton. Then there was also Camden Disability Action, which is based in Camden in London, and also My Life, My Choice, which is based in Oxfordshire. These are user-led groups, self-advocacy groups, and they were involved in suggesting adults with learning disability who we can interview one-on-one or in a focus group. North Somerset People First, the box on the right-hand side, they were also involved, but what they did was that we gave them a list of questions to ask their members, and they asked their members the questions around, well, what do you want from social workers? What do you think social workers do? What are the main things that you would want a social worker to be able to do for you? So members were asked this. North Somerset People First then wrote down the answers and sent them to us, and we included them in the work that we did. So at the bottom of this screen, I have written in red ink some of the reasons why we selected these groups. The reasons why we selected these groups was because we wanted groups who had done this sort of work before, right? So if I take My Life, My Choice, for instance, they are very active in some of their members, even to going to Parliament to talk to members of Parliament about the needs of adults with learning disabilities. So they have experiences as an organization of people speaking up. So we wanted to involve them because of that experience. We also wanted to involve as many groups as possible from around around England, around the country, because the thinking was that people in different parts of England would have different experiences. So we wanted a good spread around the country. We relied on some of the professionals and also some of the groups who were advising us. If you remember, I mentioned the stakeholder reference group who were advising us and giving us suggestions about how to do the project well. We relied on their knowledge for them to suggest to us the people that we need to be involved in this piece of work. And with all these groups, what we did was sometimes we interviewed people one-on-one. When we interviewed them, what I mean by interview is you ask people questions about what they need. Mostly it's 1-to-1 or sometimes 1-to-2. You ask them, and then we try to take notes about what they're telling us. Sometimes if they gave us permission, we also recorded what they told us because we wanted to capture every detail of what they're telling us so that we can listen to it carefully and fully understand what we're being told. Sometimes we also had focus groups where we had about 4 to 5 adults with learning disabilities sitting together and telling us the experiences of using services. And we asked people who were interested in talking to us and who can really share their experiences with us. So that's how adults with learning disability told us what they needed from social workers and social services. So on this slide here, I'm beginning to talk about what people told us that they needed from social workers. And you can see that this is about 5 circles with one big circle in the middle and smaller circles around that. And the one in the middle, I have put values and behaviors, human rights, because it seems to me that was the central point that adults with learning disability were making to us. They were saying to us, we want social workers to really believe in human rights, social workers to really protect our human rights. And in addition to that, we wanted people who were honest, who would tell us the truth, who were open with us and also with our carers. People who can communicate, who can talk to us in a way that we can understand. People who don't use jargon, people who use accessible language, people who speak not using big words that we don't always understand, or people who use words that sometimes only social workers use. We want them to talk to us in everyday language. And we wanted someone who genuinely wanted to know us and build a relationship with us, and also someone who cared for us and supported and wanted to support us. And so relationship was really important to the adults with learning disability who we spoke to develop this capability statement. And when we say relationship, what do we mean? What do they mean by relationship? Well, we want someone who talks to us rather than talking to our support worker. And I remember one thing that really sticks in my mind from talking to adults with this learning disability about this project was someone was telling us their experience about of going with their support worker to see a doctor, and the doctor was talking to their support worker about them whilst they sat in the room. And the support worker quite rightly turned around to the doctor and said, "Why are you talking to me? I am not the patient. I am not the person who has come to see you. You need to talk to the adult with learning disability and find out about them." So people wanted to be spoken to directly about their needs. They also wanted social workers to be able to talk to their family directly about what they needed. Importantly, people wanted to be listened to, and listening means the social worker taking time to sit down with them, really take in what they're being told about the needs of the adults with the learning disability, asking questions back where they are not clear about what they are being told, and really showing that they feel for the needs of the adults with learning disability. And when people also talked about good relationship with social workers, they also meant social workers trying to do everyday activities with them, going to places with them, meeting them on their own, seeing them as many times as possible to develop a relationship with them, and trying to understand what their life at home or where they live looks like. Really, really trying to understand people rather than sort of sitting in the office or calling them, or taking the views of other professionals about their needs rather than asking them directly. And I'm still on this slide here, the picture on your screen here. I'm still talking about what adults with learning disability meant by relationships. The 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 the, the relationships that social workers need to be able to build and maintain with them. What do they mean? They meant three things. They meant, well, the social worker should be able to build a relationship with the adults with learning disability who they start working with. You know, the social worker should be personable. There should be someone warm and open. As I've mentioned before, there should be someone who listens. Importantly, they should really respect the wishes and feelings of what the adults with learning disability want. And they need to have communication skills to be able to talk to them. But more importantly, about building relationship, the social worker needs to be able to explain to the adult with learning disability what they do that is different from the other professionals that the adult with learning disability is working with. You know, sometimes people may be working with a speech and language therapist, they may be working with an occupational therapist, they might have a support worker, they might have a housing officer. You know, what is it that the social worker is doing which is different from all the other professionals involved with them? And that is really key, because then they know what to go to the social worker for. Right? The second part of relationship work with adults with learning disability also involves maintaining and repairing relationships. And this one is really key, because when you talk to adults with learning disability who have experiences with social worker, they say, look, we really like our social worker, but social workers are always leaving. I'm always being told that I have a new social worker. What's all that about? Before I have time to develop a relationship with one social worker, or actually I'm really beginning to like them, they've left, and I've got a new one, and I have to start all over with them. So what they were telling us is the adults with learning disability involved in this who advised. They were saying, look, we understand that social workers have to leave their jobs. We can't stop that. But the skill that they need is to be able to pick off from the work that the last person was doing. So they need to be able to repair relationships and develop relationships quickly by showing empathy, showing feeling and understanding, and fixing relationships when they go wrong. And lastly, when people have to leave, they need to do it properly. They need to leave properly. They need to write letters to us to explain that they're leaving. They need to give us copies of our care plans and also explain the work that they've been doing and what I can expect from the next social worker who takes over. And if possible, they need to introduce us to the new social worker before they leave. And I can see that it's now 10:50, so I'm going to try and wrap up here so we have some time for questions. And so this slide that you see here, I won't say much about it other than the fact that it really shows um, what social workers told us they believe that adults with learning disability need from them. And I show this slide because social workers also put human rights at the center of practice, and it's reassuring to me and it's warming to me as a social worker to see that what social workers believe that adults with learning disability need and what adults with learning disability need from social services are the same. And so we are basically allies and we're all looking for the same thing. And again, this slide is also explaining what social workers said they thought about what social workers said about the skills that they believe that adults with learning disability needed. So I'm just concluding here, and the slide here really is showing the capability statement. Really, it's really showing what we found out from talking to adults with learning disability about what they needed from social workers, from talking to social workers about what they believe that they needed to be able to do for adults with learning disability, and also from reading a lot about research and studies about what we know about the needs of adults with learning disability. And you can see here from that slide that the green part, the bottom slide, is personal values and behavior. And then the left-hand side is knowledge and the right-hand side is skills. What we are trying to show with this triangle is to say that what is fundamental, what is the most important about social work with adults with learning disability is the personal values and behavior of the social worker, their ability to build relationship with someone, their beliefs in human rights, and also their beliefs in showing empathy and feeling for adults with learning disability. That's what you need first before you can build your knowledge and your skills. So that sits on top of your human rights value base. So to conclude then, to finish off, I have been this morning talking about what the British Association of Social Workers did to develop what is called a capability statement for social work with adults with learning disability. A capability statement is basically a document which explains what social workers need to know about adults with learning disability. That's knowledge. What they need to be able to do for adults with learning disability, that's skills. And what they need to believe in about what is right and proper for adults with learning disability, that's values. So I've been talking about skills, knowledge, and values that should be at the center of social work practice with adults with learning disability. I have been showing that we developed this capability statement from involving adults with learning disability at every stage of the process. I have also explained what we learned from adults with learning disability about what they need from social workers. And I have been saying that we were told by the people involved that what matters to them is relationships. What matters to them is values of the social worker. What matters to them is a social worker who genuinely wants to make a difference and wants to listen to them and wants to care for them. And I will finish here. Thank you very much for listening. I will now take some questions.
So I think there's a couple in the chat box that have come in while you've been talking.
Okay.
Don't know where you want to start, Godfred.
Yeah, I can't see that, Rachel, so you'd have to read it
Okay,
out.
I'll read them out. So Kim was saying that her experience of social workers is that they assess and review, then hand things over to providers, including benefits and housing.
And is that to say that's a good thing, or Kim would want them to do more than that?
Don't know. Do you want? If you've got anything else you want to add about that, Kim, if you stick it in, and then I'll scroll back up. Annie asked, were people with profound and multiple learning disabilities involved or represented in the engagement work that you did, and how were their views gained?
That's a really, really good question, and thanks for asking that. I mentioned that we went through a number of organizations who then identified or selected the adults with learning disability that were to be involved in the project. And at that stage, we did not directly involve the people with profound and multiple disabilities. But what we did is we read the research about what their needs are and made sure that we included that in developing the capability statement.
Okay. Rachel asked, could you give some examples of ways people's feedback changed or influenced the statement?
Yes, absolutely. So the key point that I have been talking about earlier about relationships was really important about how that feedback directly fed into developing the capability statement. What was most important to people, and also talking about the differences that social workers can make. Besides relationship, another really important way that feedback from adults with learning disability fed into the statement is about the health needs of people with learning disability. So when you talk to people about the experiences of working with GPs, of working with doctors in hospitals in various capacities, that then really brought to our attention the sort of differences between the health services that adults with learning disability receive and also what everyone in society experiences. So those are the ways that they really shape um, the work that we do. A third part of this, and thank you for bringing this question up, which is very important. A third part was social workers supporting parenting, um, social workers supporting adults who have learning disability, who are parents, to do their job, to look after their children, and also ensure that their children remain with them, because the feedback that we got from adults with learning disability who are parents was that social workers always express concern about risk and safeguarding, and what they actually need is support to be able to look after their loved ones within um, their family setting.
Kim asked, were there any groups who contributed from the northeast of England?
We did not have groups directly contributing from the northeast of England, but in the stakeholder reference group, there were professionals who were practiced in the northeast of England. So we had some of the experiences. But what I want to say, to add to this, is we have now developed the capability statement, and what we're doing is trying to get the jargon that we use is embedded. We're trying to get everyone to use it. So the next stage of the process is trying to get it actively in practice, and we'll be interested in working with groups within the northeast, service user organizations, user-led organizations in the northeast who want to use this in their work with social workers or in their own work, advocacy work.
Okay. Annie has said that she's had no experience of a named social worker in almost 20 years, and she was wondering what social worker training is included to develop skills, knowledge and understanding of people with profound and multiple learning disabilities.
Okay, that's another excellent question. The reason why the capability statement is so important is because we know that when social workers qualify now, there is not much about learning disabilities in their training. So part of the job of this capability statement is to serve as a go-to place for those who train social workers about what social workers need to know. So for instance, if you're a teacher of social workers, you now know that if I'm training social workers, the capability statement tells me what they need to know and what they need to be able to do, um, to to make a big difference for adults with learning disability. And so the capability statement is meant to be relevant or meant to be important to all adults with learning disability, from those who are able to do as much for themselves as possible, and those who have profound and multiple learning disability and therefore need more support from their family or from other carers.
Annie also asked, are social workers made aware of the core and essential service standards for supporting people with profound and multiple learning disabilities?
I can't answer for all the social work training programs around the country, but that feels like a very important document which should be shared as widely as possible. Can Annie say a little bit about that?
Annie, if you would like to add any more about that in the box, and we can come back to it. Kim's added some more comments about her earlier comment, saying that in her experience, social workers aren't doing a lot of work around benefits and things, and that's often passed on and signposted to other groups to do those bits of work, and that the capability, if I'm not getting this right, Kim, do let us know, that the capability statement feels like an ideal world, and that reality is quite different to some of the things suggested, and that social workers often don't regularly see people and therefore can't build relationships.
And that's a really good point. So it was mentioned that the capability statement feels like an ideal world, and actually what people experience on the ground is very different. But what I want to say about that is the capability statement is meant to get us as close to the ideal world as possible, because it really says what adults with learning disability want to happen to them in the ideal world, right? So it's trying to take us near that ideal world situation. So, as has been said, in an ideal world, actually, perhaps we shouldn't even think of it as an ideal world. We should think of it as what every adult with learning disability can expect from what social workers can do for them. So the point about benefits is also relevant here. But benefits, as we all know, have become very, very complicated at the moment. So sometimes social workers might feel that it is better to involve people who have much more understanding about benefit, the nitty-gritty of benefit that they themselves do. But the point is relevant one in the sense that at the very least, social workers should have a very broad understanding of how the benefit system work and what people are entitled to. And then they can work with them and signpost them to organizations which have much more, who have more expertise, if that is what is required. But as a starting point, absolutely correct. Social workers should have a very, very solid understanding of the benefit system. And I would say that actually most of them would know, for instance, how universal, what universal credit is and how it works fundamentally. And then they can signpost people when specialist knowledge or specialist advocacy is required around benefits. But just to finish on that, earlier on in the presentation, I talked about social workers believing in human rights. And benefits are relevant to this, are important to this, because social workers believe that it is people's basic human rights to access the benefits that they are entitled to. So even if a social worker doesn't understand the nitty-gritty of this, they would be ensuring that people access the benefits. They'll be starting that process for people getting the benefits that they're entitled to, and that may involve bringing in organizations that have more specialist knowledge about benefits.
Carly's asked, who monitors that social workers are meeting the capability statement?
Another excellent point. So the capability statement, because it's really explaining what social workers should be able to do, and what they should know and what they should believe in. The idea is that social workers managers would also be using this, A, to explain the training that social workers need, and B, to be using that to give them feedback, and also to be using that to check whether what social workers are doing are up to their right standard. So on one hand, it would be it would be managers of social workers, and it will also be supervisors. But more importantly, if you look at the capability statement, you would see that critical reflection is part of it. It's a bit of a jargon which says social workers should really be able to sit down, really be honest with themselves, think about the things that they are doing and what they could do right. And so the capability statement can really enable social workers to engage in critical reflection about what they can do and what they should be doing. So a social worker can sit down with the capability statement and say, look, the capability statement says that relationships are really important to adults with learning disability. And this is what adults with learning disability mean by relationship. When I sit down and really think about myself, do I have those skills? Can I do that? Do I have that knowledge? If I don't, then how can I ensure that I meet that standard? So there are three ways of people monitoring. One is managers, one is also social workers themselves, and one is also the people who employ social workers, ensuring that social workers have the support to work in a way that is stated in the capability statement.
Annie has expanded a little bit on the core and essential service standards for supporting people with profound and multiple learning disabilities. She said that it's a co-produced standards that offers a set of indicative national benchmarks clarifying what good looks like for people with profound and multiple learning disabilities in any service to enable commissioners of services and services themselves to evaluate the quality of provision.
Okay, that feels like a very, very important document. And after this, I will have a look at it myself. I have to be honest that I haven't come across it before, but it sounds, it appears to be very, very important. And I'll look at it and think through how it's related to the capability statement.
Annie shared a link to that, so I'm quite happy to send that over to you after, Godfred.
That would be really helpful.
Yeah. Has anybody got any more questions? I'm sure that Godfred would be happy to answer any via email as well. Is that right?
Absolutely, I would. Absolutely.
Okay. Any more for any more? Well, if not, I'd just like to say thank you for you all for joining us this morning, and thank you for joining us as well, Godfred, and presenting on this. I think it's been really interesting.
Thank you.
And either the rest of today or on Monday, a link will come out to you all with a link to this on YouTube. So if you want to share it with anybody else or you want to rewatch it again, that will be there for you. So thank you for joining us.
Thank you so much. Bye-bye, everybody. Thanks for listening. Bye.
Thank you, everyone.